2014, the Minnesota State Legislature allocated 10 years of funding for regenerative medicine research, education, patient care, and business development initiatives. With representatives from the University of Minnesota and the Mayo Clinic as co-chairs, Regenerative Medicine Minnesota, RMM, was born. RMM aims to improve the health of Minnesotans by evolving new therapies, developing the infrastructure to produce them, and educating the next generation to deliver them to patients throughout the state. This statewide initiative opens new economic opportunities through commercialization of technologies. Regenerative Medicine Minnesota leverages the strengths of Minnesota institutions to position the state at the forefront of regenerative medicine. Since inception, 459 applications have been submitted, with 123 grants being awarded, totaling more than $17.4 million. 2018 is turning out to be a very special year for RMM. Let's hear some of these incredible stories.
So the Kidney Regeneration Project at Miromatrix aims to help the nearly 500,000 patients suffering from chronic kidney disease. So our goal is to create a new source of bioengineered kidneys that will kind of offset this disparity and then help all of these patients that are suffering from kidney failure. Dialysis as a technology has not really advanced much in the last 50 years, and there are 500,000 patients that are undergoing dialysis 3 times a week on average. What's really unique about regenerative medicine as a field is that so much of what we're doing is unprecedented, and that makes this project both challenging and very exciting at the same time.
Current treatments for Parkinson's disease are very effective in the early and middle stages of the disease. Funding from RMM is critical to developing the next stages in our production methods for the mini brains to derive a cell therapy for Parkinson's disease. We hope that ultimately this whole process will lead to a new treatment for Parkinson's disease patients.
So osteoarthritis is extremely common. If you look at all age groups, it affects about 1/3 of individuals. And if you look at individuals over 65, it affects more than half of men and nearly 2/3 of women. Well, many of these patients will eventually get a joint replacement surgery, but many individuals, particularly young individuals, are not eligible for joint replacements. This grant is supporting a project that is looking at the role of proteins that allow potassium ions to move in and out of cells in cartilage. The cells are called chondrocytes, so we're looking at how deletion of these channels that allow potassium to flow in and out of cells, how that affects cartilage growth and regeneration. One advantage of the Regenerative Medicine Minnesota funding is that we can really explore new projects and new ideas and generate preliminary data that we can hopefully translate into bigger projects that are funded by the federal government and other agencies.
Our research project is to explore the neuroendocrine mechanism of metabolic disorders in obesity. Using the grants from RMM, we will investigate the scientific mechanisms of why the weight cycling occurs in obesity. And we're going to investigate a novel strategy for the obesity and the post-dieting overeating and weight rebounds.
Currently, cellular therapy for cartilage defects in the knee require 2 surgeries. Those cells have to be taken out of the knee in 1-stage surgery, expanded in the lab, and then placed back into the knee. In this setting, we're able to do it in 1 stage, using the power of stem cells to harness and promote articular cartilage generation using the patient's own cells in 1 setting. Grant funding from Regenerative Medicine Minnesota is vital to be able to fund a phase 1 clinical trial from the FDA application process through treatment of our patients.
The ultimate goal of my research project is to be able to have people undergo treatment for brain tumors, for example radiation and chemotherapy, but maintain the cognitive function that they had prior to that treatment. At the moment, people who live a long time after brain tumors have pretty significant loss of cognitive performance, and that's something we'd like to be able to get fixed. We've had a terribly difficult time coming up with drugs that work for neurodegenerative diseases. There's not a single drug we have available for Alzheimer's. And aging is something that happens to all of us, and it's the most common risk factor for neurodegenerative diseases.
This is a very unique project that people have been working on for decades to solve, and we believe that we are at the point where we have solved a problem. Last year, we committed ourselves to using an in vivo gene therapy approach where you bypass the need for surgery to take out some of the cells and directly deliver the gene delivery construct to the liver. And what we found is not only could we do that, and we could do it safely, but we could cure the disease in about half the time, meaning that there was less injury to the liver while the liver was undergoing that selection process. If the disease gets far enough or irreversible, I can't change that. But if we can treat the disease early enough in the patient's life or even as a fetus, they never have any of those other complications related to the disease.
The ultimate goal of our research project is to see whether we can use own babies' umbilical cord blood to reduce the injury due to brain injury following an intraventricular hemorrhage. Using the funding from RMM, we will characterize the stem cells that are present in the umbilical cord of these extremely preterm infants. And our hope is in future we will use the own babies' umbilical cord blood to reduce the risk of brain injury due to IVH and other causes also. Number one, get what is called as a proof of concept. And number two, for applying for additional grant funding, because we do need to have some preliminary data to show that the cells actually work.
My project is a project that funds science and research enrichment for kindergarten through 6th grade Native American students. The grant funding from Regenerative Medicine Minnesota allows these kids to engage in science, to truly become immersed in it and see things that they've never seen before. So my ultimate goal is to help create greater health equity by bringing education to children. And hopefully some will choose to enter the science and research workforce, and then they can go on to begin to address these health issues that they see their families and their own community members suffer from. The only way that will happen is with this early intervention.
Thank you, Dr.
Next fall, we'll be in 20 schools, so that is going to impact, and thanks in large part to Regenerative Medicine Minnesota. So we will be impacting more than 3,600 students next fall. But even more than that, what this grant is giving us the opportunity to do is to pilot the project in a rural area as a community-based STEM solution. And what we mean by that is that we can provide a proven curriculum. We can put local professionals into the classrooms, local role models, professionals into the classrooms, and with the support of community businesses, we can really help communities generate their own workforce in the future.
Last year, normally I thought science was all just chemistry,
like just mixing one chemical with another and then having an explosion. That's pretty much what my definition of science was. Science when scientists came. Now I think more science is like environmental engineering, building stuff, things.
All the things
More than just chemistry.
One of our fourth graders, we asked our fourth graders, before Science from Scientists, what did you think of science? And what do you think after? And this fourth grader said, well, before Science from Scientists, I used to think science was experiments. Now I think science is experiments, teamwork, and collaborating. And she means collaboration. And so I just want to thank you all for collaborating on behalf of all the students and teachers in Science from Science programming this year. Thank you.
Thank you!
I just want to say thank you to Regenerative Medicine Minnesota.
Thank you.
Thank you.
Thank you.
Thank you, Regenerative Medicine Minnesota.
Thank you. Thank you.
Thank you.
Thank you, Regenerative Medicine Minnesota.